Okay, this is our last chapter. This is chapter 42, Other Medical Specialties. There will be a series of 3 videos that will be attached to this lecture and a homework assignment that we'll discuss in class. Okay, as a medical assistant, we've talked about a number of specialty areas that you may work in and realize we couldn't potentially talk about everything in this class, so this will sort of talk about some of the other that we haven't looked at. Again, no matter what specialty that you work for, you can assist with exams. You can do any diagnostic testing and process specimens. You can certainly do your patient education. And then, of course, any administrative and clinical skills. First specialty we'll talk about is an allergy specialist, which we call an allergist. And what an allergy really is it's an inappropriate immune response. And for most of us, okay, there are times where we do get an allergic reaction. So if we touch something we don't like, say like a poison ivy, okay, our body recognizes that as foreign. We get a nice little breakout, a nice little rash, and for most of us that goes away. Okay, you'll see some inflammation, some tissue damage. But for the most part, these reactions are what we call local, meaning they stay just in one area. For some folks, they're systemic, meaning that they're found all over the body. These often happen with food allergies. Because you take food into the body, for folks who are allergic to certain things, you may see rashes all over the body, okay, when they're allergic to particular foods. The ones we're most concerned about, of course, is anaphylaxis, which is something we've talked about once before with our medical emergencies. And anaphylaxis is an allergic reaction, however, it does cause your cardiovascular system to shut down. So your blood vessels start to dilate. You start to lose blood and leak blood. Your blood pressure goes down. Your heart starts to stop working, okay, quite so well. So that is a very serious reaction. And what you actually see here in the picture on the right-hand side is a picture of an EpiPen that we have talked about before. So they do come in these little jars. Okay, they have a cap on the top, and inside that black cap, okay, at the very top one that they show there is a needle. And once that is jammed into the thigh, that needle will come out of the black cap and deliver the medication into your patient. Cardiology we've talked about once before, so that is specialty of heart disease and disorders. We have spent quite a bit of time already talking about EKGs and a couple of bad EKGs. So you do know the typical exams. We will talk about just a couple of other common heart diseases in a few moments. And we've done most of the diagnostic testing that you can do for this section. Dermatologists and dermatology, of course, deals with skin diseases and skin disorders. So we will talk about just a few basic exams and procedures and a few basic skin disorders and some of their common treatments. Really, for this section, you should understand the terminology, as you really do not diagnose any dermatological disorders, but you should understand what the medical terminology means. Endocrinology, okay, is the study of glands and particularly the hormones. So we're going to spend a lot of time here talking about diabetes, as that is a problem with the hormones. Again, you can assist with exams as needed and collect any specimens, blood, urine, okay, and saliva is often collected during these exams. Gastroenterology is disorder of the GI or the gastrointestinal system, and this also includes the organs, the liver, and the pancreas. As a medical assistant, you should understand the basic elements of your gastrointestinal system, which you should learn in A&P2. We will talk here a couple of basic disorders, treatments, and again, some terminology. We will talk about a couple of particular exams and how to prepare your patient for those exams. Neurology is the study of the nervous system. Again, there's a lot of diagnostic testing and patient education that goes along with this. We will just talk about a couple of the bigger exams. Oncology specializes in tumors and cancerous growths. They may be benign or malignant, and benign really refers to being, we call non-cancerous, just extra growth, and malignant is serious and cancerous. Metastasis refers to if it's spread to another area of the body. When we talk about carcinogenesis, what we're actually talking about here is the fact that it can be cancer-causing, so there are things that cause cancer or known to cause cancer. So as a medical assistant, you should be aware of the common types of cancers, the things that you're going to see the most often. Again, some patient education. And then family support and education is added here as an extra because when you deal with cancer, you're often dealing with whole families. Okay, in our orthopedics, of course, deal with our skeletal injuries, our muscular injuries. So you guys can do your general exams. You do have to have a specialty in x-ray, but you can assist the patient into and out of the x-ray, although someone else has to take it. What we will spend some time doing in class is talking about casting. Hot and cold treatment is discussed in physical therapy and patient education.